Well, we found in my coaching work that there are two really fertile channels to find these people. And the first one would be Facebook ads. Now, let's be clear about something. I don't believe anybody's on Facebook to see your ad.
Yes.
Would we agree with that, Naren?
100%. It is a numbers game. They are there to see what the celebrities are doing or their friends are doing.
They want to see pictures of their grandkids.
Yes.
Yeah. So, but this actually works because you could do a simple ad that says, no dental insurance, no problem. Ask us about our, and then insert the name of your membership plan, my TLC savings plan.
Right.
And then that ad, if they clicked on, and that's just interesting enough for someone that doesn't have insurance to say, let me see this. They aren't there to see your ad, but 100%. It's just interesting enough to get their attention.
Exactly. And if you have a good enough budget, you can reach 30,000 people, 40,000 people in your area. So think of it like the old mailer, but a lot more effective, because now they can click on it, you can track it, all that stuff.
You can do targeted marketing, because with Facebook, you can geofence.
Yes.
What geofence means is you can present it only to people. Let's say you're in a suburban area.
Right.
You could present it to people that say live within a 10-mile radius of your practice.
Right.
Next, you could geofence it by age. So if retirees were attracted, we could say, hypothetically, 60 and older. So that your ad would only be presented to people, if you put the two geofencing criteria together, people that live within a 10-mile, people age 60 or over that live within a 10-mile radius of the practice.
Right.
You do the same thing with millennials, because we can find them by age. Millennials, technically by definition of a millennial, they were born between 1980 and 2000, inclusive of those years.
Right.
So now, do the age on that, people that are this age that live within a 10-mile radius of your practice. Naren, I'm going to lean on you for a minute, because the gig economy workers are harder to find. We can't find them by age. But how might we, what are some keywords we might use to find them? Or what are some, fencing criteria we might use to find them on Facebook with the Facebook ad?
Yeah, I do think almost all or most gig economy workers probably are millennials, or because I'm just thinking of all the people we have used in the last 1 year. They're probably between the ages of 20 and 40. I mean, there's one or two outliers maybe, but typically I think that's there. So I think almost all of them are millennials.
So you think you can define it by age?
I think so. And self-employed, so we can sometimes it's.
But how do you use self-employed with a Facebook ad?
Yeah, so it may not work as well with Facebook ad, but perhaps with YouTube, because YouTube can watch the kind of videos you're watching, and if you're watching a lot of things that self-employed people watch, then you can say, hey, go after those. A lot of people who are freelancers are not just doing one thing; they're doing multiple gigs, multiple things, right? So they might have a side hustle on the side, and they are doing this, and they're doing a Airbnb on the, they do lots of things. So they're always looking at entrepreneurial content. So I think looking at the content, even on Facebook, I think you can target based on the type of content they seem to click on and so forth.
Cool.
So I think that's what I would do.
Well, the second channel we found, I said there were two that we found to be productive. One is Facebook ads, and the other is LinkedIn ads. LinkedIn is a social media channel, and it's a narrower audience, but it's an audience that are good for this. And think who's on LinkedIn. There's basically two audiences that are on LinkedIn. There are executives, white collar workers that are between jobs. They're looking for their next job. And if they don't have a job, guess what they don't have, Naren?
Insurance.
They don't have insurance. And there's another group of people, and those are employers that are looking for these executives.
Exactly.
And that might be an opportunity for you to do a little piggybacking, because you could do a LinkedIn ad, and someone that owns a local business could reach out to you and say, hey, I'd like to purchase this for my employees, because we're in a competitive environment. We want to provide benefits to our employees. We looked into providing dental insurance, and it was outrageously expensive, but I saw your membership plan, and this is something that works within our budget. And we think this will be a recruitment and retention tool to attract and keep the best possible employees. So now it could be, a little real estate office down the street that has, 10 employees, the bakery that has 8 employees, the small consultancy over here that has 12 employees. Typically, those businesses don't provide dental insurance benefits because they don't qualify for any of the group stuff that the deltas go after. And first of all, it'd be 3 times as expensive as your membership plan. And for a third of the cost, they can provide your membership plan to their employees and use it as a recruitment and retention tool. And the really cool thing, if you're thinking, well, this sounds great, Gary, but I don't know how to do any of this stuff. Well, do what we did at LifeSmiles and what we recommend for our clients. Equa, your firm will actually manage those ads.
Yes.
At no additional cost. It's included in your monthly service fee, but you'll manage the Facebook ads. You'll place and manage. You'll create the landing pages that relate to all of that. You do the same thing for a LinkedIn account at no additional cost other than your standard all-inclusive monthly fee. The only additional fee you'll pay as a client is the media costs. So if you're choosing to spend $200 a month with Facebook or $200, I'm making up numbers, but you can decide your own budget. If you choose to spend $500 a month with LinkedIn, then you pay that directly to LinkedIn or directly to Facebook.